My name is Paula Utila. I'm a lactation consultant here at Jamaica Hospital Medical Center. Lactation consultants can help you with any breastfeeding difficulties that you have. We are part of your healthcare team. If you have any questions about breastfeeding, could be general, or if you're having some nipple pain or you're separated from your baby, don't forget and ask for the lactation consultant.
Hello, my name is Frances Perez Hernandez. I'm a midwife and lactation consultant here at Jamaica Hospital. We are a baby-friendly USDA designated hospital, and what that means for you and your baby is that you will get the best start to breastfeeding while you're in our care. At the time of delivery, as long as you and your baby are stable, your naked baby will just be dried off and placed on your bare chest. This skin-to-skin contact helps your baby transition from the womb to the outside world and makes it easier to initiate breastfeeding while your baby is most alert during that first hour of life. Our practices such as skin-to-skin, immediately after delivery, rooming in with your baby, and the support of the nurses and lactation consultants will help you achieve your breastfeeding goals more easily. Okay, so you want to make sure that you're comfortable. You want to lean back. It's very good. He's skin-to-skin, and we can see that he's looking. You want to make sure his belly is towards your chest. You always want him at the breast level, very close and snuggled to you. Okay, with your opposite hand, you want to just support your breast and put your nipple right under his nose and tickle under his nose and wait for him to open very wide. You want to really wait for that big, open, wide mouth because you don't want the baby to just grab onto the tip of your nipple. And when he opens wide, you just want to snuggle him in with this arm in towards your breast. You always want to bring the baby to your breast, not your breast to the baby. Another position you can try is called the cross cradle hold. You're holding in the same way, but with this arm, some babies just need a little more support and guidance to open wide. So you can snuggle him close under this arm.
Should I go under the guard? Yeah.
Oh, no, you can go on top. And support behind his neck. And again, bring him close to your breast, and now with that hand, you're gonna just do the same thing you did on the other side and tickle under his nose. And that moment when he opens really big, and it's okay if his hands are there. Some babies use their hand to guide them towards the nipple, that's okay. You just wanna be patient and wait till he opens really big. And then once he's on, you wanna see that his jaw is moving up and down actively. And if the room is quiet, you can actually hear him swallowing. And when he's gotten enough, he'll let you know by just coming off of the breast. Another position you can try is something called a football hold. So you're gonna try to put him snugged under the breast that you're gonna feed from. Put his chest towards your ribs on that side, right? And your hand, exactly, supporting his neck.
On the side, like this?
Yes. And then you just wanna tuck his feet behind where you're sitting. There you go. And then you wanna, with your opposite hand, again, support your breast and position your nipple right under his nose, tickle under his nose. And when he's ready, you're gonna use this hand. When he opens wide, you're gonna use this hand to position him on the breast. Just like that, perfect. Okay, and when you have him on and he's positioned, you wanna make sure you take a deep breath, relax your shoulders, lean back. So at home, you can find the most comfortable place. A lot of women prefer feeding in a chair, and a nursing pillow can really help you. So this one, in particular, you have to wrap around your body, and then you can clip it on in place.
This is the front, and this is the back?
Yes. And then you're gonna clip that on and just tighten it so it feels comfortable to you. The idea is you want your baby to be at the breast level. You want to do the cross cradle hold where you're going to position your hand behind his neck. And then
Cross cradle, so this hand is behind the neck?
the hand that's opposite your breast that you're using. And then with the other hand, you want to just support your breast and place your nipple right under his nose and tickle until he opens very wide. And it's okay if his hands are in the way. Sometimes babies use their hands to guide them towards the nipple and the breast. Just be patient. And when he's opened wide, like you did beautifully, you want to snuggle him towards the breast as deeply as you can. And once you have him positioned on, you can relax this arm. And sometimes even some women do something called breast compression. You can use this hand, and as he's actively sucking, you can press your breast in different areas, compress, and you can see more of the sucking actively. Then you want to make believe your breast is like an hour clock, and on every hour just compress on that part.
So it's really important to teach moms how to hand express. You can hand express if your baby needs a little bit of extra breast milk, if you're not with your baby, or if you have a clogged milk duct. So learning how to hand express is really important. So I'm going to teach you how to hand express. What you have to do first is wash your hands, which we did before, and then bring your shirt up. Now, on our breast, we have our nipple and we have our areola. Okay, when you're hand expressing, you're going to take these two fingers. If you go by your nipple, you're not really getting a lot of milk. So that's why it's important to place your hands where the areola and skin meet. We're going to push our hands back towards our chest wall and kind of roll our fingers, outwards. Very good. Mommy has lots of milk. That's awesome. On some moms, in the first couple of days after birth, you might have to do this a couple times before you actually see milk. So sometimes it's difficult for the baby to latch, or the baby may not be with you. And we're going to offer the baby some of the express milk with the syringe. That's good. And what you're going to do is you're actually going to place it, not directly, you don't really want the baby to suck on it like a bottle. So what we're going to do to show you, we're going to give a couple little drops at the side. And he's just kind of lick and swallow it. Yeah, it's good, right? Yes. Another way to feed babies is by a spoon. This again is to help prevent the nipple confusion, so we don't want to offer the bottle so soon. Mom expressed some of her milk inside of the spoon, and we're going to offer it to our baby. Just a little bit too. Good. Yeah.
Your baby will come off the breast when he or she has gotten enough. And when your baby is done with one breast, always offer the opposite side at each nursing session. The next time you feed, start from the side you finish. Your exclusively breastfed baby will want to eat very frequently in the early days. Watch your baby, not the clock, for hunger cues. Feeding frequently keeps baby's small marble-sized belly satisfied and helps to increase your milk production for those early days.